Hello dears, today we are going to discuss about cholelithiasis. As you know, the cholelithiasis or gallstones are nothing but collection of crystals or stony hard crystals in the gallbladder. The formation of stones in our gallbladder is mainly due to the saturation of bile, cholesterol, calcium and other organic compounds. And it is more commonly seen in females, especially those who use the contraceptives, and in patients with some autoimmune disorders like inflammatory bowel disorders like Crohn's disease, and some other hematological disorder or hematological conditions like haemolytic anemias. And let us see who are at the risk of cholelithiasis. It is commonly seen in females, and there is a great increased risk of genetics plays great important role. Then usually middle-aged personalities, especially the age in between 20 to 40, and in personalities with very obese personality or fatty, flabby, fertile 40, something like that, or diabetes ladies. Then in pregnant ladies or those who use the birth control pills, then or other hormone therapies, and those who work hard for rapid weight loss, then in personalities with lipid abnormalities, especially in personalities with high triglyceride level. So these are the main risk group of patients, those who had or those may want to have the cholelithiasis. People traditionally considered as increased risk of cholelithiasis in people with a fatty 40 or fertile females and fair complex. That means in very obese fatty, then in personalities with 40, that is middle-aged one, then with personalities with increased risk of pregnancy, or those who use the high amount of estrogen, and in females, and in very fair, that is Caucasian, but this disputed by recent studies. And let us see what may be the pathogenesis or what is the mechanism behind the production of or the formation of stone in gallbladder. On examination, you can see there is deficiency of bile acids. That is, bile acids are very, very essential to keep the bile in very liquid form. For the bile acid is the main factor which restrict the crystallization. So in patients with a deficiency of bile acids, and that leads to precipitation of cholesterol crystals in gallbladder resulting in the cholelithiasis. So it may be due to a defective bile acid absorption from our intestine, especially small intestine, or the same can be due to impaired liver function, and there may be some obstruction in the biliary tree that may cause us backward flow of the bile, or the bile may get forced to stagnated in the gallbladder itself or anywhere in the biliary tract. The same will leads to stasis and crystallization. These are the base pathology behind the or the pathogenesis behind the crystallization of the bile. Then let us see the types of stones. Even though our patient may having some symptoms of cholelithiasis, but on revealing the X-ray, you may not get any positive findings. It is because most of the stones belongs to gallbladder are very radiolucent. That means near about 70 to 80% of the stones are very, very radiolucent. That is why you cannot get a positive X-rays, because these stones are mainly constituted by cholesterol, and the cholesterol is not a radiopaque one. And near about 15% of the stones can be pigment stones, because the stones are very black or brown in color. And near about only 5 to 10% of the stones may be very, very radio-opaque stones, because these stones contain high amount of calcium. And another variety, mixed stones, can be seen. So only the investigation of X-rays may not enough to give a conclusive or a very definitive diagnosis of a patient, a suspected patient with a symptom of cholelithiasis. And let us see what are the clinical feature of a cholelithiasis. Now your answer may be, sir, the pain may be in the right upper quadrant, or pain may be in the epigastrium, or pain may be in the back of the stones, back of the shoulder. But it can be truly silent also. That means even in our patient with more than 2 or 3 or 4 or number of stones, the patient may be purely silent. Why? As we mentioned earlier, the signs and symptoms depends on the degree of obstruction, intensity of obstruction, or the intensity of infection or other inflammation. So these are the main factors which depends the symptom severity of the cholelithiasis. And usually the symptoms may develop only when complications occur. That is, in patient with cholelithiasis superadded by infection, that is cholecystitis, or the stones may be completely blocked in the common bile duct, that is choledocholithiasis, or there may be some mucoid plaques may block the bile flow, that is mucocele, or biliary fistula, or gallstone ileus, or CA gallbladder. So signs and symptoms depends on the base pathology. And when the gallstones load suddenly in the duct, it may lead to complete or incomplete block of the biliary tree, and that is why the bile may get backflow into the system itself, and that causes engorgement of the, or that may leads to high pressure in the biliary canaliculi or biliary tree, and that is the base of basic pain. And this cause colic is shooting abdominal pain, usually in relation with a meal. You can see the most of the cholelithiatic patients may having aggravation of symptoms after meal. Why our patient is having a symptom aggravation after meal? Because after having a meal, our liver has to secrete or eject near about 50 ml of bile into the second part of the duodenum, along with the pancreatic juice, and along with the partially digested portion of the food which we had already taken. So this will give additional burden or additional or overloading of our gallbladder to contract more and more powerful. But already our gallbladder is diseased or weak. The weak or diseased gallbladder that may not enough having the capacity to eject the same. That will give again and again over more and more pressure of the biliary canaliculi or biliary tree or the liver itself, and that is the main pathogenesis behind the aggravation of symptoms after meal, especially after a heavy meal. Because if you had a very fatty, spicy, oily food, the amount and the quantity, or the quantity of the bile needed may be very high to digest properly. So in a diseased gallbladder or a diseased liver cannot synthesize and eject the same. That is why the symptoms may aggravate usually after food. And let us see the most common symptom of gallstones. It is very something like that other pain in our abdomen. The gallstone pains or the cholelithiatic pains are very, very constant or very persistent pain. It will not come and go like that of ache. It is very constant, and it does not come and go, and the same may be vary with the intensity in patients. And usually the pain may last at least 15 minutes 4 to 4 hours. The same may lasting for few days also. The pain usually severe, but the movement does not make the pain worse. Usually the pain of appendicitis or a pain of peptic ulcer or pain of pancreas or acute pancreatitis, something like that, modalities may be relation with the movement of patient. But here, the movement may not influence the intensity of the pain usually, because the pathology behind the pain is increased intraportal pressure. That is why the pain usually severe, but movement does not make the pain worse. In fact, the person experiencing biliary colic often walk about or twist the body different position in when trying to find a comfortable position, because the pain is that much very agonizing patient. The patient tosses about in bed, or the patient constantly wants to move to get a relief from the pain, and the pain is usually accompanied by nausea. The most commonly, the biliary colic is next about the location of pain. Mostly the pain may be felt in the middle of the abdomen. That means just beneath the just beneath the epigastrium or just below the sternum, and otherwise our patient may having the right upper quadrant pain, that is the right upper abdomen just below the margin of the ribs, that means in the right upper quadrant area. And occasionally the patient may complain that they had pain over the back of the right shoulder or the tip of the scapula, or especially in the right scapula, and the pain may be over the just opposite of the right upper quadrant, and that is why we may confuse that the pain of cholelithiasis with the pain may mimicking of a condition like that of heart attack. That means the pain is that much very severe. And episode of biliary colics, and in some cases we can see the episode of biliary colic may subside very gradually once the gallstones shift with the duct, so that it is no longer causing obstruction. So fortunately, if the stones may get dislodged from the common bile duct, or it may get dislodged from the second part of the duodenum, and the same may get passed through the intestine or via the stool, it may not cause a permanent block. And that is why in such condition, the pain may not be lasting for a few hours or a few days. It may spontaneously resolve as the stones may get dislodged from the obstructed areas. And if our patient is having such a anorexia, nausea, or vomiting, or severe consistent pain with fever or without fever, the condition may be polycystitis or cholelithiasis. And in such condition, along with the LFTs, we can have the investigative procedures like MRCP, that is magnetic resonance cholangiopancreatography. By doing that MRCP, we can study, we can see, we can reveal the details and data of the liver and gallbladder in a very detailed manner. And the same can be studied by doing the ERCP, that is endoscopic retrograde cholangiopancreatography. That means by using an endoscope, we can drive our endoscopic visualized data into the second part of the duodenum, and then into the common bile duct, or into the gallbladder, or some biliary tree, depending on the situation. So by doing the MRCP and ERCP, we can diagnose the condition. Then other tests are by doing the HIDA scan and duodenal drainage or oral polycystography and cholangiogram, etc. By doing, we can study the real issue or real pathology behind the real status of our patient, and by that way we can study the case. And next is about cholelithiasis. That means when the stones may get dislodged into the common bile, that can be studied or that can be dealt with the next class. Thank you. Bye.